Hi, my name's Elizabeth Brown. I work for the Northern Territory Government and the primary and public care unit with remote and rural team. The Barkly region, which is based in Tennant Creek. This is the Barkly region here where the young Wise is standing. Objective today is to promote and implement the use of the digital mental health interventions, DMHIs, such as WISER, to the remote Aboriginal communities of the Barkly, which the Northern Territory services. There's 6 that the Northern Territory Government remote team provide services to. But however, with the DMHIs, barriers that have been identified that could prevent the implementation of them to our Indigenous communities are as follows. So Indigenous community accessibility and demographic location, so access to the internet, language barriers, so English as a second language, and stigma association with preventing access. This is just a little bit of stats about the mental health related conditions within the Northern Territory in particular. So it's increased 96% over the jurisdictions between 18 and 19 years, years 2018, 19 and 2006, 2007. And that's just the 96% is Indigenous people alone. So Northern Territory is included into that. So in the decade between 2010 to 1819, there's an increase of 52 increase of hospitalizations with the mental health, Indigenous Australia, with high related conditions, such as psychosis is a big ones. That sort of hits the stats pretty high. Okay. So this is just a little snippet of the types of demographic and disadvantages that we sort of foresee within these communities throughout the Barkly. So as you can see, early school leavers is pretty high, and internet access is pretty high as well, so and even travel alone, so to access mental health care is pretty few and far between places, and just the disadvantage alone, just having other health issues, or having a mental illness and not receiving any mental health care is probably part of that as well. Low income households, so access to the internet just doesn't happen. Unemployment, is a high, 6 to 8.1 here. As in unemployment plus low income. So that sort of goes hand in hand. So it's still low income. So these are the sorts of things that we have to face if you're living in a community. And overcrowding it speaks for itself. Okay, so our critique today is access to the internet, English as a second language, preventing access through stigma implementations. So access to the internet. So the RIMT University is a led research, so released in September 2023, showed 43% Indigenous communities have no mobile service. Some communities have only limited shared phones, and a lot of them just don't have. So sorry. They just don't have access to telecommunications at all. And that's just according to the mapping of digital gap report that was done in 2023. So you also got Minister of Indigenous Affairs, Mayor McCarthy, saying inadequate service is a critical issue. So and saying that, you know, the major investment in the remote and community regional connectivity will be a game changer to ensure more communities stay connected and safe. So it talks about a lot of things, criminal health, you know, just communicating with family members. So it says it, the first sentence says it itself. And Dr. Kelmer talks about both ways, you know, having the best of it. So and the approach. So, you know, having access to internet service plus healthcare services, you know, including the clinical and specialized, you know, culturally informed areas for practice. So we're moving forward to the times. So the solutions to mental health issues, you know, it could be apps, and, you know, such as Wiser. So Tennant Creek is the regional centre for the Barkly region. It has 7 communities that live close by, so all of them, you know, basically have access to the internet. However, you know, Tennant Creek's also got the best quality of 4G mobile and broadband service access on all these sites that's close by. But however, you know, many non-Indigenous, Aboriginal people use prepaid because of there is a very low fixed internet uptake. So they're not opting out to have the internet connected within the household. They prefer the prepaid mobile service attached to their phones. However, there's limited and very limited broadband access available across the Barkly region, with the 4G coverage in the 6 larger communities, which the intergovernment services depend on mobile public phones, which are located in the community, you know, to a few and far between, probably 4, maybe 4 at most in most communities, and some Wi-Fi services. The limited free Wi-Fi service and public access to computers, affordability constraints, internet access, and the use of digital services. So that sort of says, you know, it needs to be something needs to be done about. Within that, the mapping and digital gap report, and we have 2 communities that have connected to date, which are 2 of them that we service as part of the 6, which is Alikarang and Arapalum. Yeah, so that's a concern. Second issue or barrier would be, as we sort of identified, is English as a second language. And English as a second language is, we already spoke about it, about leaving school early, and so living in a community where English is generally not used every day, social or household interactions. It's not spoken. The development of good oracy skills in the first in their first language is good, but then you haven't got it in the English language. So you're still looking at English as a second language, and understanding and spoken and grammar, you know, doing the written sort of thing is not there. Using the printed word, having to read and read is something that sort of is part of an interaction with these apps, that such as Wiser, which you have to read and type at the same time. So reading and writing, and learning English is knowing that English is used worldwide through television, but interactions with non-Aboriginal people in their community just doesn't happen, you know. So there's more minority is the non-Indigenous or Aboriginal people. So you've got more Aboriginal people in these communities than white people, non-Indigenous to white people. So that interaction just not there, besides not going to school, and majority of them are the school teachers or the clinic staff. So, they don't access it often as they should. And disrupting because of cultural and ceremony reading. So, some that do go to school, but they're also got the cultural obligations, such as, as they get older, they've got to go and do, sorry business and so forth. So they have to be disrupted from school and that learning of English language. Then you do get some that do know some of the English language and words, but it's very much in very pidgin English, as in they think it sort of simulates English, but then that understanding. So it's the ear that has to hear it. So it sort of created a new language, which is Creole. And like in the households, Aboriginal people are very family orientated, so the language is spoken in the household most of the time by the older ones, and it's sourced down. So, it's there in the household. So that's something that sort of needs to look at with when the use of introduction of apps, digital apps as interventions. Okay, preventing access. So preventing access talks about the stigma around accessing apps or mental health care, or even having a mental health illness. Public stigma, public stigma is involves a negative view and discrimination attitudes from others. So, especially if you've got a mental illness, but even just accessing mental health care within, the community, there's always, that, peer pressure, and, you're getting called mad or something like that, just that peer pressure, or which one, or there's words for it within the community. Self stigma as well, that negative being, and it refers to negative attitudes that people with mental illness may have the initial shame, just and denial around the conditions, or even seeking help. Just it's a shame job type thing. So, the people, they don't want people to know. So, and that internal thoughts, where it's denial, and it can evolve into something bigger, and into eventually, you might have mental health problems or issues, then it sort of turns into a mental health illness. So that prevention is not sought. So to have that wiser online apps maybe can eliminate some of these things. Structural stigma as well, that sort of involves policies and governments and private organisations that intentionally or unintentionally limit opportunities for people to access mental health care. It's, for example, low funding for mental illness research that doesn't get injected enough, fewer mental health services relating to their own other healthcare, which is understandable, like chronic disease and, alcohol and other drugs. So that's sort of high on the ranks as well. But, mental health is something that needs to be put in there as a priority as well. The cause of inequality is due to the structural disadvantage brought to you about by social policy, economic, and disruption of power and resources. Social determinants of health also is having substantial effect on mental health and social emotional well-being. Now, people with mental illnesses are more likely to experience a disadvantage and be on low income, as we sort of spoke about earlier with the graph, with many living in poverty due to the circumstances. In these circumstances, people are not only more likely to experience a mental illness, but also lack of access to mental health care, and are less likely to be able to access mental health support services due to their situation. So yes, I think that most of mental health services address mental health conditions once they have emerged, rather than addressing the underlying causes of distress. Are using a clinical approach and treats rather than prevents. So even say early intervention have effective services, early access to effective services can help diminish the effect of these problems and help restore people's social emotional well-being. That's the WHO's definition of, part of that research as well. So let's move on to the next, which is implications of implementation. So with this one is the individual differences, such as demographic and medical history. So we're looking at the race, medical history, and the impact on how people will respond to WISER, yet still remains unexplored and not cannot be answered directly as we speak. So you're sort of looking at that. For example, researchers suggest that young people are hesitant to access mental health care due to the perceived stigma. Other researchers indicate adolescents prefer online conversations to the in-person interactions for management of difficult conversations. Considerably, then younger people may respond differently to the use of WISER for mental health care. There is also a lack of information regarding how race, ethnicity, gender, culture, and other factors may play a role in the response. So, to the outcomes associated with the now supported digital mental health intervention. So, I think there's still a lot of research, especially when it comes to Indigenous communities and implementation of the use of the interventions such as the digital mental health supports. Okay. Okay, quality, impact, and inclusion in digital apps. So access to quality mental health care and the problem is multifaceted. So digital mental health apps can be provided a valuable service to those accessing those unable to access mental health support. Further, the future directions for digital mental health include improvements within their technology to charter for various users, increasing the capacity to contribute to clinical unity, access to the quality of mental health, access to and quality of mental health care. Aboriginal population represents a considerable proportion of the Barclay, yet they experience a major mental health disparities. They often have less access to healthcare, and the available care is frequently of poorer quality than the available to non-Indigenous population. The goal is to decrease the mental health differences between the majority groups and is a current and national effort. So that's on the cards and those on the table already, but it's a very slow process. The implementation of the, say, Medicare, ACA, say Medicare and other government safety net programs has contributed to reduction in the odds of an individual with mental illness, but being not being able to afford mental health care. Lowering the barriers and accessing treatment, and the reduction is in the delay of seeking help among the Aboriginal population communities. The gap has not been closed. So there's no, I think it's widening more than closing. It includes the lack of community-based interventions. This is the multifaceted problems. Lack of community-based interventions, unequal access to evidence-based practice, the lack of resources and funding with health services. So just the mental health care is not getting funded enough. Overall, the literature shows that the individual in the racial ethnicity minority groups are also receive less than optimal care in the following ways. So it's not just Aboriginal people, it's a lot of the migrants that come over as well, sort of feeling the blunt of these things too. However, I think Aboriginal people are still under the radar because the location and demographic areas that they live. These individuals are 20 to 50% less likely to eliminate mental health services use. 40 to 80% more likely to drop out of treatment prematurely. Mitigate, sorry. They are more likely to utilize psychiatric emergency services, to enter emergency treatment by means of law enforcement, and to be involuntary hospitalized. Despite the utilization of emergency service and inpatient facilities, they are less likely to receive regular outpatient care after discharge. So that alone, so especially within remote communities, a lot of the people, besides having that initial care, and because a lot of the clinics out in the communities are primary healthcare focused, mental health doesn't sort of fit in that category because it's all chronic disease, it's all very biomedical type. So yeah, so it's a specialized area. AAD sort of even doesn't get the judge either. And then they, if something happens and they're needing it, they have to go into town, Alice Springs, far and far between distances. And then, people get left with, say, stress, then it turns into depression, then it goes into something else and something, it ends up being a diagnosed illness. And then, in the end, it becomes psychosis, and then they have to get dragged into Alice Springs Hospital, put in a ward, far from home, far from family, where some of these things can be prevented by using some sort of app or, the new technology, digital technology in mental health care. And they're also less likely to experience symptoms of remission, and less likely to improve with the global functioning to return back to work or normal function. Yeah, that's pretty sad though, yeah. Okay, mitigation. Early intervention may prevent mental illnesses and suicide deaths. So, stigma associated with mental illnesses or disorders is a key factor to preventing people from accessing care they need. That's the gist of this story. So, by introducing WISE or some sort of mental health intervention digital program into the primary healthcare units as a practice, may decrease these things. I don't know. Anyway, it could work, especially in remote locations. So, primary strengths and limitations. You've got to look into that as is your, draw card to make it sort of happen. The primary strength is that, to our knowledge, it's the first investigation and incorporated in additional psychosocial intervention into the community. So introducing it. The primary limitations that are there was no, that you have to get a controlled group first. So you do the introduction, then start doing this research sort of thing, and get the control group, and reducing our ability to establish casualties or potential factors responsible for engagement. So try not to cause the illness or further problem, then prevent it. They mentioned, say, around the mental health care required is comparative. So you've got to compare it somehow. With especially in a community, it sort of varies, especially when you've got cultural implications as well as mental health care, mental illnesses. So yeah, there's a bit of a lap over there sometimes. The intervention programs could also be available in they're all, sorry, start again. A lot of these programs of digital interventions are in English as their first language. So that's something that needs to be sort of looking at. The direct feedback from the users of the program would be able to follow them up, would help understand their experience better, to customize psychosocial support service to fit their needs. Having a larger sample of size across the demographic would be brilliant, do the whole 6 communities. So this is all about the research and trying to implement. Would help establish a greater degree of confidence and positive and or negative outcomes, so you'd know. Further information would be about the app was provided to the qualified like the Indigenous population or Aboriginal populations in these communities, and start their journey, say start from finish, and able to monitor. They might have individuals who need the intervention from a mental health professional over a period of time. It might work reverse. So it's something to sort of think about. So moving on, client testimonies. So with this sort of speaks for itself. When you read this one, it sort of talks to me more about the younger person. Sort of brings me to that sort of how they use it, so it sort of says, I really enjoy so far. I feel I can about things I feel good or bad about without judgment. So that sort of speaks to me for a younger person. This one here sort of talks to me about more of an older person. Helps me a lot. So even just the simple things like relaxing after a tough day, of course, yes. So this is help people. It's very cool. It's sort of a very positive testimony. So yep, recommendations. So with the recommendations, it sort of talks about, I'll sort of talk about the our digital mental health intervention, WISER, which is intended to facilitate individuals who need mental health care in an accessible and affordable way. So that could be debatable too. Sorry, I shouldn't have put in affordable way, but that's maybe part of the research. how we can get it into the PBS or something. Who knows? However, more research has suggested that digital support digital mental health interventions for inter-Aboriginal communities, particularly addressing the language barriers, i.e., you could just do text to talk, say there's no written positive, that's more of a positive outcome, so they can just speak into, but then, let's put it into language as well. It's a possibility. Yeah, anything's possible. Community education around regarding stigma, look into ways for it to be included in the program. So, I didn't see it in Wiser where it talks about the stigma related about social and individual, so internal. So maybe just a bit of education around that within the program, as well as in the community as well, how good, it's about education. The idea of making the digital mental health interventions part of an alternative plan to address the needs and deliverance of mental health care in remote locations, policies within the Netherlands government to incorporate these programs or interventions into their primary health care practice plan. So that's a big, but it is doable. It's just a matter of, continuing this conversation. Okay, thank you very much.